John is here to translate into Spanish, just in case somebody from the media working for a Spanish language station and anybody viewing out there who may be bilingual or speaking Spanish primarily, try to make sure you get all the answers you need to your questions as well. So at this point, Chad, are you with us today?
I am.
Hey, your calming voice. Thank you. We have Brian.
Brian, your microphone's self-muted. If you wouldn't mind unmuting it, we can get you.
There we go. Sorry about that. Thanks, guys. I guess this is for Rebecca or Marcy. Just wanted to ask why the county is taking such strong steps with masks right now at a time the state isn't even mentioning it on their list of precautions. And I guess I'm trying to figure out the coordination between the two. Are you completely independent in your recommendations, or do you team up with the state to try to come up with a cohesive message? Thank you.
That's really interesting, and I do know the state is working on some messaging around masks, and I'm not sure what their timeline is on that, but this is really an internal decision by leadership here at the county. We have been providing masks to employees since late March, early April. Of course, at the same time, the number of employees was reducing drastically as far as the number of people coming in to departments and working directly. If they had a job they could do from home and telework, then they were allowed to do that, and therefore they didn't have to worry about that. But now that more people are coming back to work, this has been a leadership decision, certainly in consultation with public health. So I will ask Marcy to come back up and address that.
So thank you for that question. We absolutely discussed with the state our recommendations and how we were going to be really promoting and asking our community to start being vigilant with wearing masks when you aren't able to maintain 6 feet of distance. The state is actually working on a mask campaign that they hope to have released next week. And you'll also see local public health departments all over the state start promoting that same campaign. So this really does come as a result of seeing our increased positive cases rise and our hospital numbers rise. So when we see that happen, we know that's going to be partially due to social distancing and things starting to open up, but that's when it's really important that we're vigilant on the personal things that we can each do and the personal responsibility to help minimize the spread so we can continue to see our businesses open the way that they are. But that is definitely in line with the state.
La pregunta es, ¿por qué el condado está tomando pasos fuertes ahora con el uso de las mascarillas en comparación al estado o anteriormente? Y si estamos trabajando de la mano. La respuesta es absolutamente. Estamos trabajando en conjunto con otros departamentos de salud, especialmente con el Departamento de Salud del Estado. Y esto es muy importante, usar las mascarillas, porque sabemos que no podemos mantener distanciamiento de 6 pies en muchas ocasiones y por eso es importante el uso de la mascarilla. También ustedes van a empezar a ver una campaña para el uso de mascarillas que viene del Departamento de Salud del Estado, empezando la semana que entra. También esto es el resultado de que estamos viendo números mucho más altos de COVID-19 en nuestra comunidad y por eso hay que usar todas las medidas de precaución. También es una responsabilidad personal y estamos en línea con el mensaje también del Departamento de Salud del Estado.
Thank you, Brian, for that question. Chad, do we have somebody else with a question?
We do. Nicole Grigg has a question. Nicole, your microphone is live.
Hi, thank you for a question. This is probably for Dr. Sunenshine. So the state says they expected to see a rise in cases. Is this the type of increase that is leading us to a second wave, or where mitigation efforts will need to be made again? And the second part of that, they also insist we have hospital capacity. Is that a good enough response to the record numbers we're seeing?
Okay, so the question is about, the second question was hospital response, but would we characterize this current rise as a second wave, if you will? So I know there's been a lot of talk about the second wave in the various models. So Dr. Sunenshine will take that question for you, Nicole.
So the way that I look at a second wave is basically that the disease disseminates and kind of goes away and then comes back and affects those who are still vulnerable to the disease. So I don't view this increase in cases as a second wave, but rather just a continuation of the spread of disease. We were on an upward trajectory, and then the governor delivered an executive order for everyone to stay at home. So we basically took all the people who were susceptible to COVID-19, and we kept them at home and away from others, so that the disease simply lost a place to go and spread in the population. Now, it continued to spread amongst the people who were exposed, but it spread a lot less because people were at home and away from others. So then when that got relaxed, the disease that was still circulating in the community was able to just spread more rapidly. And remember, for this disease, for every person who's infected, it infects 2 to 3 more people. So if you do the math, one person's infected, that infects 2 to 3 more people, they infect 2 to 3 more people, and you see a very rapid escalation in cases, and that is what we're seeing. So it's really more of a continuation. Your second question, I'm going to let Joanna Molina translate before I go to the second question.
La pregunta es que si el incremento que estamos viendo ahora en el estado es resultado de que estamos viendo una segunda ola o es simplemente que no hay suficiente capacidad de la segunda parte de la pregunta. Entonces, si estamos viendo una segunda ola, la respuesta es que no necesariamente. La forma en que Salud Pública del Condado de Maricopa ve esto es que se ve la enfermedad regresa. Cuando una segunda ola se presenta, es que la enfermedad se ha ido y luego regresa con más fuerza. En este caso, lo que estamos viendo es que la enfermedad continúa y se sigue propagando en la comunidad. Lo que había pasado, cuando los números al principio empezaron a subir, hubo una orden ejecutiva que pedía que la comunidad se quedara en casa. Una vez que esa orden venció y que la gente empezó a salir, hubo muchas más personas contagiadas con la enfermedad de COVID-19. Lo que sabemos es por cada una persona que está infectada, puede contagiar hasta 3 más. Entonces, de ahí vienen los números que estamos viendo.
Somewhere between 13 and 20% of all the public health confirmed cases are hospitalized. And those hospitalized cases do end up in the hospital at some point during their stay. But what happens as we get further along in this pandemic is that the people who are most severely ill in the hospital end up in the intensive care unit. And what we've learned is they get so sick that they end up on a ventilator for many, many weeks. So when you're seeing an increase in cases and you have 13 to 20% of all of them being hospitalized, with, I believe it's about 4% of them ending up in the intensive care unit. And then you have all the other people who have been in the ICU for 3 and 4 weeks who need ongoing mechanical ventilation. That's when you start to run out of beds. And so what we're seeing is that people are staying for such a long time and more new cases are coming in that we are seeing a downward trajectory of the available beds. there are a few different ways that we can resolve this issue, and we're looking at all of them with our healthcare partners and with the state health department. And they include perhaps doing fewer elective surgeries. They also include alternate care sites where people who maybe don't require as much care either in the intensive care unit or in the hospital can go to another place or a step-down unit before they can go back home again. And we're looking at all of these solutions together to see how we can maintain hospital capacity so that we can maximize people getting the best care possible.
La segunda parte de la pregunta era que si hay suficiente capacidad en los hospitales para el número de casos que se están viendo de COVID-19 en el momento. La realidad es que al momento entre 13 a 14% de los hospitales están viendo mucha más gente que está siendo hospitalizada, que se queda dentro de los hospitales por mucho más tiempo. Pueden ser personas que tienen alguna condición crónica, que se quedan y que necesitan más atención debido a que necesitan ventiladores para poder subsistir. Entonces, incremento de personas por un largo periodo de tiempo en los hospitales disminuye la capacidad de camas dentro de los mismos hospitales. Entonces, lo que se está tratando de hacer ahora es ver de qué manera se puede trabajar con los hospitales y ver si hay sitios alternos para seguir darle tratamiento y cuidado a las personas sin tener que disminuir la capacidad dentro de las instalaciones y hospitales.
All right, thank you very much for those questions, Nicole, and some detailed responses for you there. Chad, do we have somebody else with a question?
We do. Allison Steinbeck has a question. Allison, your microphone is live.
Thank you so much for holding this briefing. My question is, are there any particular sources of outbreaks that you've identified, like congregate settings or something like that, that could help explain the high case numbers, or are these larger case increases due primarily just to more community spread throughout the county?
Dr. Sunenshine, so the question is there a specific place that we're seeing this or a source of this, or is this just wider community spread? Dr. Sunenshine?
So the answer is yes. There are focal outbreaks, and there is also a lot of community spread going on. We are continuing to work closely with long-term care facilities, some of whom have ongoing outbreaks, although I'm happy to say that a lot of long-term care facilities have actually, once they implemented all of their isolation precautions and they got PPE and training, they have gone 28 days without a single case and are now no longer in that full sort of lockdown with everyone in isolation precautions. We've seen other outbreaks. There was one associated in a meat plant. We know that there are cases in the jails, and we know that there are cases among those experiencing homelessness. And we work with these communities to make sure that they are getting the most contact investigation, they're getting help with personal protective equipment, and that their housing is being supplied if that's necessary in order to keep them isolated. But that is not enough, those focal outbreaks, to explain the large increase in numbers. We know it's also people going back to work, people interacting, people engaging, sometimes in groups of more than 10, and that's why it's so important to keep those groups of people down, and then if you do interact within 6 feet, to wear that cloth face mask.
La pregunta es si hay algún específico o un área donde hay más infección de COVID-19 en la comunidad? La respuesta a ambas es sí. Sí hay sitios donde hay más personas que están siendo infectadas con COVID-19 y también está en toda la comunidad. Entonces, lo que estamos viendo es que ahora con la distribución también del equipo de protección personal, el saber que hay más personas que se les puede ayudar, sabemos que hay sitios donde la gente se congrega que pueden estar en más alto riesgo, incluyendo las cárceles, las personas sin hogar. También ahora que la gente ha regresado a trabajar, ya no puede mantener el distanciamiento quizás de 6 pies o más. Por eso la importancia de usar la mascarilla cuando no puede tener una distancia de 6 pies o más entre una persona y otra.
Thank you, Allison, so much for the question. Chad, do we have somebody else with a question?
We do. Ann Ryman has a question. Ann, your microphone is live now.
Thank you. I'm wondering if you were surprised by the number of cases and the rise in hospitalizations, and given the rapid increase, are your contact tracers able to keep up with all the new cases?
All right, so a question about contact tracing. We covered how we've been ramping this up, and we've been updating you guys for the last several weeks on how we were doing this. Dr. Sunenshine will be able to expand on that.
So honestly, we were not surprised by the increase in cases. We knew that when people started to interact more socially, that the more interaction that you have, the more cases that we're going to see, and then reliably with more cases, there's always a certain proportion that are going to end up in the hospital and a certain percentage of those that will end up in the intensive care unit. Second half. Oh, as far as Maricopa County being able to keep up, we have actually worked with a number of partners. Originally, we were hiring a lot more full-time personnel in order to keep up with the investigations and the contact investigation portion. As you know, we partnered with Arizona 211. Additionally, since the number of cases to investigate has increased so dramatically, we've partnered with the University of Arizona and with Arizona State University, who has a number of students who are able to help us. So we are able to contact all of these individuals. We've also, of course, implemented a texting system, so if it takes a little bit longer for someone to reach you when you're positive, we urge you to fill out the survey online that will come to you from a text message, and to go to our website and find out all the things that you can do to protect yourself and those around you.
La pregunta es que si ahora que han surgido muchos más casos, se le puede dar seguimiento a cada uno de esos casos y si nos tomó por sorpresa o estábamos preparados. La respuesta es que no nos tomó por sorpresa, hemos estado trabajando sabiendo que puede haber muchos más casos en la comunidad. Ahora que la gente empieza a interactuar más, que empezó a regresar de trabajo a trabajar, puede haber muchas más personas que se puedan contagiar entre sí. Por eso es muy importante que demos seguimiento a estos casos. Muchos de esos casos pueden terminar hasta en cuidados intensivos. Entonces, una de las formas que nosotros trabajamos es no solamente contratando más personal en salud pública, sino también con agencias que son nuestros socios como 211, el número telefónico, y también ahora hemos hecho algunas asociaciones con universidades como ASU en U of A, donde también los estudiantes podrán ayudarnos a contactar a las personas para darle seguimiento a esos casos que estuvieron infectados con COVID-19 y los contactos cercanos. Y también a través de texto empezamos el contacto con muchas de estas personas contagiadas para empezar la conversación y darle seguimiento.
All right, thank you so much for the question. Chad, do we have somebody else with a question?
Eric Fink has a question. Eric, your microphone is live now.
Hi, Eric here from Tucson. I just wanted to see if you guys could once again go over those latest numbers. I had something with 27% of all COVID cases reported in our state over the last couple of weeks. Also, what is the plan in the future if you all reach hospital capacity and someone comes in, gets very ill? What's the plan there to make sure they get the care they need to try to get the best possible outcome?
So what is the plan for people to come into the hospital system, but the hospital system is, I guess you'd say, maxed out at that point? What is the plan to make sure they get the best care they need? I think Dr. Sunenshine talked about this quite a bit, and she was talking about, and I can't remember, was it 27% or 37%? 27%. Okay. Do you want to expand on that? Okay.
So just to clarify those numbers, since we are receiving now an average of over 600 cases per day for the last week to 2 weeks, what I said was that out of all the cases that we've had just in Maricopa County alone, not statewide, in the last week we've seen just over a quarter of all the cases just in the last week. That's how many new cases are being reported to public health. And regarding the plan, if somebody is in the hospital and requires a higher level of care and there isn't a bed available in that hospital, Arizona Department of Health Services has set up a surge line, and all the hospitals, healthcare facilities, and long-term care facilities, as well as long-term acute care facilities, which are kind of in between, are all aware of this line and registered, and if they need to transfer a patient to another facility that has an open bed, when they don't, they simply call that line and Arizona Department of Health will facilitate that transfer, and that has been working very effectively for the community.
La pregunta es, ¿cuál es el plan cuando una persona llega muy enferma al hospital y pudiera que no existiera capacidad para la persona en el hospital? ¿Qué sucede en ese caso? Que si hay algún plan. Bueno, para aclarar los números, los que mencionamos anteriormente es que son 600 personas más o menos los que se están reportando por semana tan solo en el condado Maricopa. Eso es un cuarto más de todos los casos que hemos visto por semana nosotros aquí en el condado Maricopa. También con la cuestión de la capacidad, el Departamento de Salud del Estado trabaja con diferentes instituciones, incluyendo los hospitales, también centros médicos, para transferir a las personas que estén enfermas en caso de que no hubiera capacidad en un hospital, pudiera existir en otro hospital. Y ha estado funcionando bastante bien. Esta es una línea telefónica solamente dedicada para el personal médico, para ayudar a colocar a los pacientes en donde haya disponibilidad en los hospitales.
All right, Eric, thank you so much for the question. Chad, do we have somebody else? I don't want to push our time too much, but 2, maybe 3 more questions.
Okay, Allison has a follow-up question she'd like to ask. Allison, your microphone is live.
Hi, thank you so much. I'm wondering how concerned you guys are about these case increases. Is there more serious action that we should be taking at either the state or county level, given the trends we're seeing, beyond just kind of individual action?
So whether it needs to be systemic change in any sort of way, Marcy Flanagan can address that.
So as far as the changes go, we all know that it was really important for businesses to get back to work, individuals to be able to feed their families, put food on the table, all of those things. So for public health, it's a balance. It's figuring out where we are in our comfort level of being able to treat everyone who has COVID in our community, but also to have our economy continue to thrive. So for us, it's important we find that balance. That's why it's everyone's responsibility to make sure that we can stay where we're at. We did expect, I want to emphasize, we did expect to see an increase with cases as things started to open back up. So the numbers have not been a shock to us yet. We are expecting that, but if we continue to see a rise, that will absolutely be a conversation with the Arizona Department of Health Services, and ultimately that'll be a decision made by Governor Ducey on whether any stay-at-home orders or any other statewide mitigation strategies happen.
La pregunta es que si debe ser más estricto en cuestión de los cambios que se están viendo en el condado o el estado, o que si solamente la responsabilidad personal es suficiente. Bueno, es muy importante que la gente regrese a trabajar, que regrese a sus actividades para poder poner comida en su mesa. Y es un balance en salud pública saber cuándo la gente puede regresar a hacer sus labores y también cómo cuidar al que está enfermo. Entonces, para darle seguimiento a todos estos casos, estamos monitoreando y sobre todo trabajando con otras instituciones. Y la responsabilidad viene siendo de todos. Si cada quien hace su parte, disminuye la posibilidad, el riesgo de contraer COVID-19. En cuestión que si los casos nos sorprenden, no necesariamente nos han sorprendido al momento, pero si llegaran a seguir creciendo estos números, entonces tendría que haber una conversación mucho más grande con el Departamento de Salud del Estado, ya sea que el gobernador decida crear otra orden para quedarse en casa o hacer otro tipo de cambios.
Thank you for that question. I believe it was Allison again. Chad, do we have anybody else?
We do. Bram Resnick has a question. Bram, your microphone's live.
Yeah, hi, Fields. Thanks
Hi,
for
Bram.
doing this again.
Sure.
Marcy and Rebecca both said they weren't surprised by the cases. I can tell you a lot of folks out there are surprised by this surge, an exponential surge, and they're asking, why now, 4 weeks after the stay-at-home order ended, is everybody suddenly getting religion and saying we need to wear masks? And follow-up to that, should the county board say, if masks are so important, should the county board declare that masks should be worn countywide?
Well, I don't know that the county board certainly doesn't have the power to require people to wear masks countywide. There are a number of board members that are publicly wearing masks. Certainly, if you're within 6 feet of people, it has gone from a recommendation to a requirement for employees here at Maricopa County. So we certainly want to lead by example whenever it comes to that. Yes, everyone here is saying it wasn't a surprise because everyone knew when there was more public interaction, as both Marcy and Rebecca have said today, that there would be more cases. But I believe Marcy will expand on that a little bit more.
So when I say that we weren't surprised, as Fields mentioned, we know in public health that when the social distancing measures start to relax, when individuals are not under stay-at-home orders, there is going to be more community spread. That was expected. For the public, I understand this is not easy to see. It can be scary. It can be worrisome that are we doing enough? Is public health doing enough? Is the state doing enough? I can assure you that conversations happen almost daily between the state and the county. They certainly happen on a daily basis between all 15 county health officers to make sure that we are doing everything that we can to ensure that our state and our communities are safe. So evidence tells us, scientific evidence tells us, as things open up, as individuals go outside, as they interact more, the spread is going to increase. Why we are pushing masks so hard is because we know that individuals don't want to go back to a stay-at-home order. We've heard that loud and clear. Everyone appreciates being able to go out and have dinner with their family, appreciates to be able to go back to work. So there's some personal responsibility that we can ensure that those things stay in place, but that the spread is flattened to a level that keeps our hospitals being able to still function at a level that can protect us all. So the evidence now also supports that we wear masks. Early on in this, you recall public health saying wearing a mask is really protecting others around you. We now know as with any new disease, studies come out, new evidence comes out, and so the evidence very strongly is supporting wearing cloth face coverings. And now it's showing, as Dr. Sunenshine mentioned, it's not protecting just others around you, it also brings you some protection. So knowing that we have asymptomatic spread happening, we have widespread happening, that's why we're really pushing everyone to wear a cloth face mask when you can't maintain that 6 feet of distance.
La pregunta es, ¿por qué ahora, después de 4 semanas, es importante usar las mascarillas? ¿Acaso la Junta de Supervisores puede hacer mandatorio el uso de las mascarillas en el condado Maricopa? Bueno, no sabemos si en este caso la Junta de Supervisores no tiene el poder para hacerlo, que la gente pueda usarlo mandatoriamente en el condado. Sin embargo, lo que médicamente se nos dice es que cuando decimos que no estamos sorprendidos por los números, es que sabemos que una vez que la gente empieza a interactuar entre sí, empieza a regresar a sus trabajos, va a haber más contagio de COVID-19. Entonces, mucha gente se puede preguntar, ¿estamos haciendo lo suficiente o qué otras cosas podemos hacer? Bueno, Salud Pública del Condado Maricopa es tan solamente uno de los 15 condados que diariamente tienen conversaciones juntos para saber cómo está la situación y qué se puede hacer. Entonces, es muy importante que la gente que interactúa entre sí use las recomendaciones adecuadas, porque la mayoría de la gente lo ha dicho, no quiere regresar a que se queden en casa con una orden ejecutiva. Entonces, hay que hacer nuestra parte, responsabilidad de cada persona, hacer su parte, porque la evidencia también así lo dice. Usted usa su mascarilla, protege a las personas que están frente a usted y también hay protección para usted mismo, especialmente cuando hay gente asintomática en la comunidad que puede estar propagando COVID-19.
Well, we are just about out of time on the webinar, and I certainly don't want everyone to get cut off all of a sudden. So I appreciate your time today. Reporters that are still on there, if you do have follow-up questions, you know how to reach us here at the Joint Information Center. I would also encourage anybody who's joining us publicly via Facebook or YouTube, if you want more information, you can go to maricopa.gov/COVID-19. There is a wealth of information there. If you're interested in the statistics, we have all of those there. We have lots of advice that's either been vetted by the folks here at Public Health or links to the CDC or other trustworthy websites. And you also will have an option there if you want to subscribe to our newsletter that we put out Monday through Friday that has clips from these press conferences. It has the latest information as well as easy to share information as well. So if that's something you're interested in getting into your inbox, we're trying to reach people every way we can through this pandemic, and we know it's going to be a long haul. We appreciate you being with us today, either via the webinar or via the social media platforms, and thank you to those members of the media for getting the word out and getting this important information out there. We'll let you know when our next availability is. We appreciate you being here today.